Good afternoon. I'm Dr. Ethan Colliver, and I'm a physician at Valley Sports and Spine Clinic, as well as the clinical director of Valley Active. We're continuing our series of functional exercises for different conditions. And with me is Dave. Dave, why don't you introduce yourself?
I'm Dave Cicchini, rehab specialist here at Valley Active.
And today we're going to go over one of my favorite all-time exercises. If I were allowed to only prescribe one exercise, it would probably be this exercise, and it is the squat. We're born knowing how to do it, and we should be able to do this very functional exercise throughout our life. Indications are for, really, it's a whole lower body workout. It's also aerobic, and so anyone who has a back and legs that can get up and move, I think should do this exercise. I suppose red flags would be, or contraindications is, if you're having a lot of back pain or leg pain when you're doing this exercise, then hold off, stop, and talk to your healthcare provider before you initiate it. Dave, you want to go demonstrate?
Absolutely,
All right, I'll follow you. Sure. So, as always, we're going to have Dave do some demonstrations for us, and he's going to demonstrate, there are lots of different kinds of squats. He's going to demonstrate a simple, standard, two-legged squat.
Okay.
First he'll show us the correct way, and then we'll go over a few sort of pitfalls and things to watch.
Okay.
So go ahead and demonstrate.
And I'll give you a frontal view and a side view here. So this would just be basic front. And then to the side.
What you'll notice, especially in the side view, is Dave's hips are, go ahead and do it a couple times, Dave's hips are staying behind his feet. They're not going forward, so he's not coming forward. His knees are relatively staying over his feet. They're not coming forward a lot. The other thing you'll notice is he's keeping his feet flat on the ground, and he's not having a lot of heel rise. Dave, show us if your heels come up, what that would look like. So when this happens, you start now shifting the force generation out of the hips and pelvis, where your really powerful muscles are, and instead you start shifting the force into the thigh muscles, which aren't as powerful and aren't as functional as your hips. So the other thing he was showing us, when your knees come forward, show us again. So again, if your knees come forward too much over your feet, then again you start loading the thigh musculature and start losing the strength and power out of the hips and pelvis. Again, the largest muscles in the body are in the pelvis, so you want to use those properly. A few other tips would be, don't go into lumbar flexion too much. Show us that again. So Dave is now going into flexion through his low back way too early. Show us that again. And show us proper. So his trunk is staying more upright, and he's not really having that forward lean too much when he's doing the squat. So I believe that's an excellent squat. Also, some pitfalls can be, why don't you show us the frontal view?
So this is frontal.
And show us one where the knees sort of knock in. So one also thing to watch out is to make sure that your knees basically stay over your feet and not sort of cave in too much. This reflects, again, that you're leaving your pelvis where the force is really should be generated. And again, because of pelvic weakness, you're starting to bow in your knees. So I think those are great examples. There's a few other nuances, but we'll stick to those simple ones. For starting out, I sometimes prescribe this maybe 5 or 6 in a row and do a couple of sets of that, and maybe do that 3 or 4 times a day in the beginning. As you get better, you can go up to 25 or even 30. And if you're having pain when you start this, stop, talk to your primary care physician or other healthcare provider before going forward more. Thanks.